Hi, I'm Dan Mangru with your Newsmax TV Money Report. Today we have a special interview with clinical expert, a chairman of the Academy of Pharmeceutical Science and former vice president of Bristol Squibb, Dr. Zola Horovitz. Dr. Horovitz, it's a pleasure to have you on the program today.
Thank you. Glad to join you.
First off, I wanted to discuss Obama's health care bill. Already in the U.S., healthcare spending reached $2.4 trillion last year. By 2017, healthcare spending is expected to be 20% of GDP without a single nickel of Obama spending. Is adding more trillions of dollars to the healthcare budget the answer?
Well, I'm not an expert on the whole healthcare system, but there's no doubt that it needs revamping, and we have to slow down the growth of the pace and the growth in the healthcare system. And there are a number of good ideas out there on how to do that, but we'll see what Congress comes up with.
Well, another Obama initiative that he's already passed was the raising of the cigarette tax. He more than doubled the cigarette tax to over $1 a pack, allegedly to provide a disincentive for people to stop smoking. Given your experience in pharma, do you think this will work? And doesn't it just hurt low-income workers and seniors on fixed income?
I think that's very true. The history has shown that when they do raise the cigarette tax, the lower income people get hurt because they continue to smoke and continue to smoke as much as they did before. I think there has to be other ways of attacking the problem of smoking. And obviously, smoking is one of the worst things anyone can do as far as the life expectancy. And the healthcare system really suffers because these people get chronic diseases of the lung and cancer and heart disease. And until we can find some way to control that craving and slow down the usage, we're not going to save the potential that is there for the healthcare system.
Well, even though America is dramatically increasing its healthcare spending, the major pharmaceutical companies haven't seen big jumps in their stock prices. Dr. Horovitz, you've sat on the board of directors of many of these major pharmaceutical companies. What's Big Pharma doing wrong right now, and what could they do to boost the bottom line profits?
Well, the pharmaceutical industry is changing very rapidly. There are a few things we can point to. First, we talked about the healthcare reform and the government putting terrific pressures on prices so that it makes it harder for the industry to recover their costs of research and development. And around the world, there's terrific pressures by other countries that have the ability to set the price themselves. And, of course, they set it very low, giving their populations the benefit of the research that mostly goes on in the United States. The other thing to talk about is generic competition. The next decade will see major products, billion-dollar drugs, facing generic competition. Drugs such as Lipitor and Plavix and Viagra will see their sales and profits decrease well over 50%. Now, the industry has a few ways of trying to cope with that. Unfortunately, their internal research and development has just not been productive enough to make up that shortfall. So they're trying a few things. You're seeing a lot of consolidation of the big pharmaceutical companies, examples being Pfizer and Wyeth combining, and then Merck and Schering-Plough are going to combine. And you're also seeing the larger companies looking at small companies for their new products. One example occurred this week where Bristol Squibb bought a small biotech company called Medarex because they have products in clinical trial. And I think a third thing that's going to happen is the companies are going to look more and more towards the over-the-counter products. Some companies like Johnson & Johnson and Novartis have done a very good job in bringing OTC products out that kind of give them a hedge against problems with the ethical pharmaceutical RX business. The OTC allows them to at least have some other ways of making their sales and profit numbers. I think there are many opportunities there. One I can just briefly talk about is a company I've been doing a little consulting for, and it reflects back on our discussion in smoking. It's a company called Zero Smoke, and the reason I got interested was because I saw that there really are no products available now that have any efficacy that don't contain nicotine or other toxins and have side effects. So we don't have a good product to control smoking. This company, Zero Smoke, utilizes a proven scientific concept of acupuncture to control the craving for cigarettes. And Zero Smoke has no systemic side effects. It isn't given systemically and does not need FDA approval. And they do have clinical trials completed or in progress that are showing some effect on the tobacco craving. So it's hoped that this product can help control the smoking problem and provide a larger company to get involved and help promote and sell Zero Smoke, especially throughout the United States and overseas.
So if I'm an investor out there and I'm looking at the pharmaceuticals industries, should I be looking for a new wave of acquisitions to come from the big pharma companies such as Bristol Myers Squibb, from the Pfizers of the world?
I think you're going to see acquisitions from the big companies and also from the moderate to smaller companies who are now facing issues of growth. The smaller companies can go two ways, well, three ways. They can develop their own new products, which is difficult. They can sell their company to the big boys, such as Bristol Myers, or they can combine or do acquisitions of companies in their own size or smaller, and especially in the OTC market, I believe we're going to see the moderate to small companies looking for products like the one I just described or others. These products are going to be very attractive to small or moderate companies, even if the big companies don't get involved in them.
Dr. Horovitz, clinical expert and former vice president of Bristol Myers Squibb, thank you so much for taking time out of your busy schedule and coming on the program.
I enjoyed talking with you. This is a major problem, and hopefully we're all going to make good progress in the future.
Good man. Thank you very much. Signing off, I'm Dan Mangru for Newsmax TV Money.
Homeland Security advises every family to have an emergency radio. It's essential for severe weather, power failures, even terrorism. Now Newsmax is offering you an emergency radio absolutely free. Just pay shipping and get the radio, plus a free trial subscription to Newsmax magazine. Go online to Newsmax.com to check out the details of this great offer.
Get your free emergency radio today. Just call 800-NEWSMAX. Make sure your family is protected. Call now, 800-NEWSMAX.